Anxiety and panic disorder are like having a fear alarm in your body that goes off when it shouldn't. Imagine your body has a built-in system designed to protect you from danger, like a smoke alarm that warns you of fire. But with anxiety and panic disorder, this alarm goes off without any real threat, making you feel scared and worried a lot of the time or very suddenly and intensely. Anxiety is when you feel really scared, worried, or nervous about things that might happen or about nothing specific at all. It's like having a worry bug in your mind that makes you think about bad things that could happen, even when everything is okay. This worry bug can make it hard for you to do everyday things like going to school, hanging out with friends, or even just going to bed. Panic disorder is a type of anxiety that comes with panic attacks. These are moments when the fear alarm goes off all at once in a very loud and scary way. During a panic attack, you might feel like you can't breathe, your heart is racing, you might sweat a lot, feel dizzy, or even think you're having a heart attack or that something terrible is going to happen. These feelings come on very quickly and can be very strong, but they usually go away after a few minutes. People with anxiety or panic disorder often find that their fears and worries are much stronger and last longer than the average person's. This can make it hard for them to live their lives the way they want to because they're often avoiding things that make them anxious or trying to cope with the intense fear and physical feelings that come with panic attacks. Some signs and symptoms include feeling very tense or restless, having a hard time concentrating, being easily startled, and having trouble sleeping. Physical signs can also happen, like a fast heartbeat, sweating, shaking, feeling dizzy, or having trouble breathing. People with panic disorder might avoid places or situations where they've had panic attacks before, worried they'll have another one. Doctors often give them medicine to help them feel better. The two types of medicine they give out the most are called SSRIs and benzodiazepines. SSRIs, or selective serotonin reuptake inhibitors, are a kind of medicine that helps the brain handle a chemical called serotonin better. Serotonin is important because it helps control our mood, and by having the right amount of it, people can feel calmer and less anxious. Benzodiazepines are another type of medicine that doctors often give people who feel extremely anxious or have panic attacks. These medicines work quickly to help relax the muscles and calm the mind, which can make someone feel better in stressful moments. Both of these medicines can be very helpful, but it's important for doctors to choose which one is best for each person. Sometimes they might even decide that a mix of both of these is best way to help someone feel better. The two classes of medications most commonly prescribed for anxiety and panic disorders are 1. Selective serotonin reuptake inhibitors, SSRIs. These are often the first-line treatment for anxiety disorders. Common SSRIs include sertraline, Zoloft, which is an antidepressant and is manufactured by Pfizer, escitalopram, which is Lexapro, which is an antidepressant. Escitalopram is manufactured by Lundbeck. Lexapro is manufactured by Forest Laboratories. 2. Benzodiazepines. These are sometimes prescribed for short-term relief of severe anxiety symptoms. Common benzodiazepines include alprazolam, Xanax, is a Schedule 5 controlled substance depressant and is manufactured by Pfizer. Lorazepam Ativan is a depressant and is manufactured by Pfizer. Sertraline is a medication used to help people who feel very sad, worried, or nervous. It is often used to treat conditions like depression, anxiety, panic attacks, and obsessive compulsive disorder, where a person may have repeating thoughts or actions. Sertraline works by changing the balance of certain chemicals in the brain called neurotransmitters, which are involved in mood and behavior. This helps improve feelings of sadness and worry, making people feel better over time. Escitalopram is a medicine that helps people feel better when they are sad for a long time or very worried. It works by making more of a special helper in the brain called serotonin available. Serotonin is a substance that helps your brain keep your mood stable and makes you feel good. So, by having more serotonin, escitalopram helps brighten your mood and calm your worries. Alprazolam is a medicine used to help people who feel very worried, scared, or having panic attacks. These feelings are often part of conditions called anxiety disorders. Alprazolam works by calming the brain. It does this by boosting the effects of a natural chemical in the brain, GABA, which helps bring a feeling of relaxation and calmness. Lorazepam is a medicine that helps with anxiety, trouble sleeping, and feeling very stressed or nervous. It works by calming the brain and nerves. It makes the effects of natural chemical in the brain stronger, which helps you feel more relaxed and less anxious. Sertraline is given as a pill that people swallow. It can be taken with or without food, usually once a day. It's important to follow the doctor's instructions on how to take it. Escitalopram is given to people in a pill or liquid form that is taken by mouth. It's important to follow the doctor's instructions on how much to take and when to take it. Alprazolam is taken by mouth in either pill or liquid. Lorazepam can be given in several ways depending on what it's being used for. It can be taken by mouth as a pill, received through a vein intravenously into a muscle intramuscularly, or a form that can be placed under the tongue for quick absorption. The way lorazepam is given depends on the situation and what the doctor thinks is best. When someone takes sertraline, they might feel sick to their stomach, have a hard time sleeping, feel more anxious or shaky, sweat more than usual, or have trouble eating and weight changes. They might also feel tired or dizzy, have a dry mouth, or experience changes in how they feel sexually. When someone takes escitalopram, they may feel sick to their stomach, have a hard time sleeping, feel more tired than usual, or have a dry mouth. They might also feel dizzy, shake a bit, or have a hard time going to the bathroom. When someone takes alprazolam, they may feel sleepy, dizzy, or have a hard time remembering things. Some people might have a hard time walking straight, feel weak, or make their mouth dry. When someone takes lorazepam, they might feel sleepy, dizzy, have a hard time thinking clearly, feel weak in their muscles, making it hard to move around or do things. Some might find it hard to remember things that happened recently. It's also possible to feel sick to their stomach. They may feel restless or have changes in how they feel or act, like being more excited or getting upset easily. When taking sertraline, certain medicines for cough, pain, and cold, or for feeling nervous might have interactions. Drinking grapefruit can make sertraline act differently in the body. Also, drinking alcohol is not a good idea because it can make you feel sleepier or more dizzy. When taking escitalopram, certain medications such as other antidepressants, blood thinners, and medicines that affect serotonin levels in the brain might have interactions. It's also important to avoid alcohol as it can increase side effects like dizziness and difficulty concentrating. Some over-the-counter medicines and herbal supplements can also have interactions. Additionally, grapefruit and grapefruit juice may also have interactions. When taking alprazolam, certain antibiotics, antifungals, and heart medications might have interactions. Also, drinking alcohol or taking drugs that make you sleepy, like some painkillers, sleeping pills, or medicine for mood disorders, can add to the sleepiness caused by alprazolam. Eating grapefruit or drinking grapefruit juice can cause interactions. When taking lorazepam, certain medications for allergies and sleeping pills can have interactions. Also, drinking alcohol will have interactions. Sertraline and escitalopram can sometimes make people feel tired or have less energy, which might make it harder to start exercising or to exercise as intensely as one might like. However, for some people, these medicines can improve their mood and energy over time, making it easier for them to exercise and stay active. Alprazolam and lorazepam can make people feel drowsy, which can reduce motivation to exercise or impact the ability to perform physical activities safely and effectively. Coordination and reaction times may also be affected, increasing the risk of falls or injuries. In summary, while sertraline, escitalopram, alprazolam, and lorazepam can help improve mental health, they might also make exercising a bit more challenging by causing tiredness, drowsiness, or less motivation. Anxiety and panic disorders are when a person feels worried or scared much of the time, sometimes without clear reason. These feelings can be so strong that they get in the way of daily life. People with panic disorder also have sudden, intense fear that comes quickly. It can feel overwhelming, called panic attacks. These attacks can make someone feel like they can't breathe or are having a heart attack or losing control. To help people with these disorders, doctors often suggest medication. Medication can help balance the chemicals in the brain that affect mood and fear. It is very important to not mix alcohol, drink grapefruit juice, or eat grapefruit while on these medications. It is also very important to know what drugs, medications, herbal remedies, and foods can cause interactions.